For a long number of years, you will be aware that I have been calling for increased supports and services within our mental health service across Cavan Monaghan, because very sadly we've seen a marked increase in the number of young people losing their life to suicide. I want to thank Mary Butler, who has responded to my ask, and I had 3 very specific asks. One was to have a scan nurse allocated to Cavan Monaghan. Now, a scan nurse is a suicide crisis assessment nurse, so somebody who has the skill set to respond to families and young people or any age group who finds themselves in a very dark place. Secondly, I asked for extra hours within the primary care service to be allocated for psychological support for people in a dark place. And thirdly, that we would have somewhere tangible, a place for young people to go who may not necessarily meet the threshold for CAMHS, but certainly need support, something along the models of Jigsaw. And I'm really happy to have been informed by the HSE and Minister Butler that that is now happening. A framework has been drawn up, staff are being recruited, and I'm very confident that we'll have an entity in place that come January, only 1 month away, referrals can be taken. So it is really good news. It may not be for the families who have lost somebody, but certainly for the families who have young people or anybody suffering with psychological needs, supports, that this has been delivered. Again, thank you to Minister Mary Butler, and I will continue to work on this. But finally, just to say that there are people who are at the coalface of this working on the ground. Dr. Bergen, I'm thinking of, Emer Mulligan in the HSE, Pieta House, So Sad, Bailborough Mental Health, and I want to specifically thank Fiona Gilmore, who keeps very much this as a top priority for me, and finally Jerry Soden within the GA, who do tremendous work quietly within communities right across Cavan Monaghan. Thank you for your work.